Hello everyone, good evening. Welcome to Sunday Live session. My name is Dr Tanima Singhal and I have 12 years experience in obs and gynae. My graduation is in Ayurveda and since 3 years I am practicing as a childbirth educator, pregnancy educator, lactation consultant and Garbh Sanskar expert at Maa-Si Care Clinic, Vikas Nagar, Lucknow. We take offline and online consultations also. Today what is my top and my post graduation, I forgot to tell you, my post graduation is in reproductive child and health. So today's topic is it safe to work out while pregnant? So first of all, we must know that if a lady is pregnant and she has done exercises before, like before her pregnancy she has done exercises, she has an experience of knowing about what are the exercises and about to do's and don'ts of the exercises, still she has to always consult her doctor first to take her permission whether she doesn't have any kind of complications and all that, so that she can further move into exercises. But if you have no experience of doing any kind of exercises, that time also first you have to talk to your doctor and then start always with stamina building exercises. You should not go for directly exercises. You can start your stamina building by walking, taking brisk walk, and then slowly gradually moving into exercises, that too always with the help of an expert. Okay, now what are the recommended exercises during pregnancy? The recommended exercises during pregnancy are walking. You can swim or work out or water workouts, but always in the presence of some guide. Yoga and pilates classes, low impact aerobic classes, and strength training. These are the major groups of exercises which can be done by any pregnant lady. But always a caution, you should always consult your doctor first, and also it should be done under guidance of some expert. It should not be tried by yourself. And suppose you have experience, like you have done it before, still once talk to your expert and then only can do it by yourself. Now, what are the exercises to avoid during pregnancy? First of all, we must know that if you are into sports or you have done some sports before, but still during pregnancy, what are the sports which you should not do? So in that, gymnastics, downhill skating, horseback riding, diving and bungee jumping. These are not at all recommended during pregnancy. Now, the exercises that carry high or risk of falling or abdominal injury, that should be really taken caution. So the balance exercises, it is better. First you start with strength training, get your proper balance, and then you can go for that. But still it is recommended only in the presence of a guide or a mentor. The exercises that involve lying flat on your back, they should be avoided. The abdominal exercises where there are advanced abdominal moves, they should be avoided. Exercises in super hot weather, especially in North India, we find sometimes the temperature reaches around 40 degrees. So that time the mother should, the lady who is pregnant can work out, but in a comfortable weather, like she can have her AC on or cooler on and the room temperature is not too high, then she can go for workouts. The exercises which involve back bends or other contortions, that should be avoided during pregnancy. Jumping, bouncing and sudden jerky motions to be avoided during pregnancy, and excessive or bouncy stretching, holding your breath for long time, it is not recommended during pregnancy. Holding your breath, now there are specific pranayams and yoga sessions where holding breath is taught to the mothers to have good lung capacity, but again you have to see your comfort at a place when you feel that you are getting becoming very nauseating sometimes, so that is the time when you should stop, because there should be an regular reach of oxygen to the baby. So that is very important and it should be gone gradually. That is why it is recommended to do it only in the presence of an expert. Okay, now what are the limits that you should set while exercising during pregnancy? 30 minutes a day is sufficient for a beginner or a middle level person who has done exercises before, I mean. But for advanced level, that who have done previously and have been exercising regularly, for them it depends on the fitness level, they can do more. Now, Keep having sips of water to avoid dehydration. And if you feel at any time that you are feeling dizzy, then just stop at that time, take rest, and possibly in the left lateral position, you should take rest. Right? Posture is very important. Posture, I cannot stress more on that, because this is such an important thing, that posture during pregnancy is very important, not only during exercising, even while you get up, how you're walking, how you're sitting. Posture is very important. Mothers sometimes complain after delivery that they get chronic backache. So chronic backache is basically because of your posture, wrong posture. So posture has to be very properly done, and you should know why this posture correction is important. During pregnancy, the center of gravity of the mother shifts a bit. So that why the whole pressure of the baby and the growing fetus is on the back, on the spinal cord. So that's why mother has to always remember the correct posture of lady is very important. Okay. Now, what are the signs where you should stop exercising? That is excessive fatigue, tiredness, irritability. If you're feeling irritable, there is some kind of joint or muscle pain, or you find it difficult in sleeping in the night. If you have trouble sleeping, then just talk to your expert and talk to them, share your the issue that you are having trouble in sleeping in the night, and it might be due to some wrong posture or something which is disturbing your sleep. So get yourself checked, then only you can continue your exercises. When shouldn't exercise? You should also understand the conditions during pregnancy when exercises are not at all recommended. That is severe anemia during pregnancy. If you have low hemoglobin or any kind of anemia during pregnancy, you should not exercise. If you have anybody is having chronic lung or heart conditions, that should heart conditions also and lung condition also, at that time also exercises are not recommended, but still you can talk to your expert and your doctor. If they say it is a milder form and you can exercise, then you can go for it. Placenta previa is a condition where placenta is near to the opening of the uterus. So that condition is also not advisable for doing exercises. Cervical insufficiency. Now, how you will understand what is cervical insufficiency? There is a history of recent miscarriages during early periods of pregnancy. So one of the reason is cervical insufficiency. So you can talk about that more if you have such kind of condition. That time also exercises are not recommended. Preeclampsia or pregnancy induced hypertension. That means you have increased blood pressure during your pregnancy. So this is again a condition where you should talk to your doctor, and if they say that it is a milder form of hypertension or preeclampsia, if it is not a preeclampsia or there are chances of that time it may be advisable, but you should do with caution and under the expert guidance. Then there are risk factors for premature labor and are pregnant with multiple pregnancies. So suppose you have twins or triplets or more. So that time also exercises are usually not recommended, or if they are recommended, that should be done with caution and only under the expert guidance. So again, it has to be first talk to your doctor. So, and if there is a history of premature rupture of placental membranes during your last pregnancy, or suppose there are some chances that this time in this pregnancy there are some chances for that, then also exercises should be done only after consulting your doctor. It should not be done by yourself. So hopefully this session was informative and you found something new to learn today. And if you really found it informative, kindly share this video, like this video, and share it with mothers you know. If you know anybody in your family who is pregnant, you can just share it to them. So this is Dr. Tanima Singhal signing off. Take care. Have a nice time. Stay safe. Bye-bye.